My name is Dr. Sonya Ephraim, and I work for Mercyhealth as a urogynecologist. There are several different types of urinary incontinence. The most common types are stress urinary incontinence and overactive bladder. Stress urinary incontinence is a leakage of urine with activity, physical stress. The stress that most women will experience is coughing, sneezing, exercising, jumping up and down, and they will notice leakage of urine. It can be anywhere from drips to splashes to big accidents, and some women will experience this enough that they end up having to wear pads or panty liners or different types of undergarments to help protect themselves from the leakage. Overactive bladder is a type of incontinence that comes with urgency. So that sudden onset of urge where you have to rush to the bathroom. It doesn't give you very much warning, and some women will feel as if they've lost their sensation because that warning is so fast. They get the gotta go syndrome and can't get their pants down fast enough to make it to the commode in time. Women of all ages can experience urinary incontinence. Patients from their early teens until their 90s will experience urinary incontinence. It really depends on risk factors that you've been exposed to throughout your life. So I may have young athletes who do very vigorous sports, weightlifting or volleyball where they're jumping a lot, and they can have urinary incontinence. And then I have other patients who, as they get older, they may have onset of other comorbidities, Alzheimer's or Parkinson's disease, that can increase their risk of urinary incontinence. And then there's also certain genetic disorders. If you have a connective tissue disease, that can contribute to onset of urinary incontinence, perhaps earlier in life than you would think you would necessarily have it. Overactive bladder, which often presents to women as an inability to control their urge to urinate, often presents with a sudden onset of urgency where they have to rush to get to the bathroom. These patients can often also present with frequency, so they're going to the bathroom much more frequently than they ever did. And then they can wake up at night, which is called nocturia. Waking up at night approximately 1 to 2 times after the age of 60 is fairly normal, but if you're waking up more than that and it's disrupting your ability to get a good night's sleep, then that is an abnormality that you should talk to your physician about. You should speak to your doctor about urinary incontinence when it starts to affect your quality of life. If you find yourself not participating in activities and enjoying every day, then it's definitely time to speak to your physician, because there are lots of treatments that are available, some surgical, some non-surgical, that will greatly improve your quality of life. Urinary incontinence is treated in a number of different ways. Initially, we would have to have a thorough history and a physical exam so that I can determine what the underlying type of incontinence is. And then once we know the type of incontinence, we can come up with a treatment plan, which may include treatment of the urethra if you have stress urinary incontinence, or it could involve treatment of the bladder itself if you have overactive bladder. The treatment of stress incontinence, when we're addressing the urethra, usually entails a minor outpatient surgical procedure, which is very well tolerated and has a minimal recovery. Whereas treatment of the bladder for overactive bladder usually involves changes in your diet, changes in your behavior, and medications. If those fail, then there are more invasive treatments available, but for most women, they do very well with that.